Hi everyone, this is Adrien, the exercise specialist from the Leduc Beaumont Devon Primary Care Network. I hope you all are doing well today. Today I thought I would show you guys some exercises that you can do for your rotator cuff muscles. Your rotator cuff is actually made up of 4 muscles. It's your supraspinatus, your infraspinatus, your teres minor, and your subscapularis. So those are 4 small muscles that are located on your back, posterior to your shoulder, that actually help stabilize your shoulder and your humerus through all the different planes of movements that you can think of. Now they are secondary stabilizers and secondary movers to the actual muscles of your deltoid. So your shoulder, obviously you have your anterior, your medial, and your posterior deltoid muscles, and they're secondary to those. But they are very important muscles. You often see people getting rotator cuff strains and tears, rotator cuff inflammation, things along those lines. And those things can often occur because those 4 little muscles of your rotator cuff are, just as I said, little. They're generally underpowered and not quite strong enough to maintain kind of the stability needed for the forces that are going through the shoulder. So there are lots of different ways that you can work your rotator cuff muscle to help strengthen them, to help keep your shoulders more stable, as well as there's rehab components to it and stretching components and so on and so forth. So this video is not going to be or shouldn't be used to diagnose any potential rotator cuff pathology or injury. Always seek a professional, either a physician, physical therapist, so on and so forth, in order to diagnose and get a specific treatment plan for you. But this is just a few commonly recommended exercises to help strengthen up your rotator cuff muscles. Oftentimes, a lot of these exercises can even be used as a warm-up before doing some resistance training, just to make sure there's some blood flowing through the muscles and they're ready to handle whatever load you might be putting on them, whether that's resistance training, so on and so forth. So, as per usual, if you're new to physical activity, if you're returning to physical activity from a long layoff, or if you have a medical condition that might make doing physical activity difficult, please consult with a physician prior to beginning any new exercise program. And as I already said, these exercises should not be used to diagnose any rotator cuff injury. They're simply examples that you can consider using, and are often used in some treatment plans for people with rotator cuff pathologies. This is not an exhaustive list of exercises. This is just some of the more common ones that are commonly prescribed. And we will get started, and we'll show the different ways that you can do them. I will say off the hop, there are certain types of rotator exercises that actually use like an examination table or a physio table, so on and so forth. I do not have one of those in my home gym here, so I won't be showing those ones. There are some other great, even sometimes more intensive versions of rotator exercises that you can do if you're able to lay down on a surface like a table, even a couch where your arms can hang over, so on and so forth. So to begin, the pieces of equipment that I will be using today are a band that is currently fixated to a surface, a dumbbell. Today I'll be using my handy dandy 5-pound dumbbell, and a stretching band, and a stretching kind of a rope or a band. People that don't have these can use things like a tie or exercise bands, a piece of rope. People use things like shoestrings. So these are great if you aren't quite as flexible, to help you reach places and to help you stretch. As someone myself who isn't overly flexible, they are very helpful. So, to begin with showing you guys a few basic kind of movements. Generally the rotator cuff can be worked through what is called external rotation. And so that's external rotation through the shoulder. So what that is externally rotating out. So if you think about it, I'm currently opening up my shoulder and rotating outwards. So they can be worked through external rotation or through internal rotation, so bringing it in, rotating inwards. So that's when you're, so that's obviously when your humerus is perpendicular to the floor, obviously, so they're against your side. If you abduct up to 90, you can do the same thing with internal rotation and external rotation. Those are the two kind of primary movements to train your rotator cuff muscles in, either through internal or external rotation, and then either through complete perpendicular humerus bones to the floor, so get your side, or abducted up where you're parallel from the floor at 90 degrees. Generally, we don't want to be way up here, way down here, 90 or down at your side in general. You should also never try doing these exercises super heavy. Your rotator cuff muscles are muscles that should be performed with really proper form, as are all exercises, to be fair, but these are really small, intricate muscles, and people chronically injure them. They're chronically inflamed for a lot of people, and we want to really make sure we're able to train them properly and healthily. So what we'll do is I'll show you a few exercises that you can do with the band first. I'd say that, actually, we'll show the dumbbell first. So what you'll often see people doing with a dumbbell is, they'll hold it down at your side and you go out like this, right? You'll do your external and your internal rotations, so on and so forth. It's probably the most common one that you'll see people doing. Now this is great for a warm-up and things like that, to help give a little more force when you're trying to get your rotator cuff through a better range of motion. Some people, if they can't go out all the way, adding a bit of weight will help them go out a little bit further. But holding a weight, the force is currently going down. So it's activating my bicep. And yes, I'm using my rotator cuff to rotate it outwards, but what we want is horizontal force going into the rotator cuff to actually stress it properly. So this is a less effective movement with the dumbbell than we would currently want, and I'll show a better version of it after. But what we do will often see with the dumbbell that is a better version is if you hold your arm up horizontal to the floor at 90 degrees. Now we want to use the forces of gravity that are going straight up and down that a dumbbell actually provides you, because that's what we are resisting against when you're holding your arm up. So what we do is we start up here and we're going to rotate down to 90. And if you can go below 90 if you're able to, but it's by no means totally necessary, and then back up. So you see my elbow and my upper arms, my shoulder to my elbow remains roughly in the same position. All right, so up and down. So now this is only five pounds. Now I'm a pretty strong guy, and this is about all the weight I would ever use for this. See, I'm going nice and controlled. I'm not winging it all around the place. Just going up and down. Up and down. Same thing with the other arm. Horizontal to the floor, 90 degrees, up and down. It's probably tough to tell on the video, but I do have slightly better range of motion in my rotator cuff on my left side as opposed to my right side. Everyone is generally a little, off balance somewhere, and that's something that I can work on. And I will show stretches afterwards that you can do to help work on those things. See, perfect. So see, I'm able to get a much deeper on this side overall. See, I'm going nice and controlled. Rotator cuff exercises, because like I've said, there are small muscles and we're training them pretty lightly, but we do still want to fatigue them somewhat. They are great to train anywhere from that 12 to 20 repetition range. If you want to do a few sets of that, fantastic. So that's often a better use for the dumbbell, is holding up here as opposed to down at the side. Now, more often what we will tend to see is people using a band for this kind of things. Now, as you see with a band, me pulling the band out is creating horizontal forces. So the band is pulling me that way, which will engage the rotator cuff properly, and it'll cause the rotator cuff to actually contract. So you see, there's no forces going down besides the natural force of gravity, obviously, but there's no external forces going down anymore like the dumbbell provided. Now we have horizontal forces, right? Lateral forces. So see, the further out I go, the more resistance there is. So these are often fantastic ways to actually train the rotator cuff. So I'll see I'm tucking my elbow into my side. So now we're going to work on internal rotation. So I'm holding it, and I just rotate it in, and then back out. In, and back out. In, and back out. Really working on that full range of motion here. And back out. In, and back out. In, and back out. We can also do the opposite movements. We can work on external rotation. So I'll switch hands, so I'm still facing the camera obviously. elbow tucked into your side here, and out. So as you see, still have horizontal forces, but instead of rotating inwards, I'm now pulling outwards. So both directions do a great job working the rotator cuff muscle. If I was to choose the most effective, that's depending on the individual, but more times than not, doing an external rotation movement like this will generally target the rotator cuff a little bit more. Once again, internal rotation where it's pulling, you know, and external rotation. Similarly, as with the dumbbell, you can do the actual horizontal to the floor version with one of these as well. So what I'll show here is I'll come down on my knees so that it stays roughly, so the band stays roughly horizontal with the floor. You can do it with the band up there and so on and so forth, but if we keep it roughly horizontal to the floor, even a slight angle upwards, that's what we would prefer. So as I did with the dumbbell, I'm going to do internal rotation, but with the band. So obviously the further I go, the more it's able to work. So we're here, until I rotate and back, until I rotate and back, until I rotate and back, until I rotate and back. Now, if you see from the side, my forearm here is getting, you know, pretty much straight up with the ground. You can even go further if you want and actually work on getting a bit of a stretch in there, which is one of the stretches that I always recommend if you're able to. Because the band is just lightly pulling and it's stretching out those muscles there, even some of the upper pec and anterior deltoid muscles. But you see my elbow is staying roughly in the same spot. All right, so that's the internal rotation version. Now for the external rotation version, we come on the other side here. So now obviously I'm pulling the band this way, there's horizontal forces, so I'm having to use the rotator cuff muscles a little more intently here. So you see, elbows to the same place, up and back, up and back. See, I'm going from roughly 90 degrees here. If you look, you know, compared to the backdrop behind me where the black mat is, I'm roughly parallel with it, going up to just past 90 degrees, but hitting about 95 or so degrees there, which is fantastic. Up and back, up and back, up and back. So those are fantastic. Those are generally like the basic movements you will often see people use for those. You can also do things like what is called scapation, which is simply, you know, thumbs facing forward, you know, scapation, also known as, you know, as shoulder flexion. You know, it's just the same movement. That's often exercise that can be used. We have other more intensive versions of exercise where we'll do like a complex, where we'll have people leaning forward, elbows out, and we'll do all these kind of different movements for them. But those are individual bases. So whatever I showed you is kind of the primary movements that are often done. Now we do like those to be done through a full range of motion, obviously, which I was showing. So full range of motion is, you know, the furthest that my joint and muscles will actually go in the motion, right? Everyone is different. Like I said, my range of motion on my left side is a little better than on my right side, so that's something I need to work on. If it's too painful to work through a full range of motion, a partial range of motion is totally fine. It is better than nothing. And finally, if the movement in general is painful, a further alternative is what's called isometrics. So what isometrics are, and I know I have talked about this in a previous video, but isometrics are a type of exercise where you're pushing, so you're actually pushing into something or pulling something. You're putting a force into something that isn't going to move. So, for example, pushing into a wall. The wall isn't going to move, but you're pushing against it. So you are still getting muscle contraction and exercise without actually moving the muscle. So when you have issues with range of motion, isometrics can be a great alternative in the meantime. So for example, what I can do for that is I can work on external rotation with a wall. So if I'm not able to, if this is a painful movement, what I can do is I can put the wall here and I can push into the wall. But my hand isn't going to be able to move when it is against the wall. But it will still be getting some of the it will still be getting some of the actual resistance training and the muscular contraction that we want through the rotator cuff exercises. So for example, I'm against my wall here, elbow is tucked to my side, and I'm going to push into the wall. So I'm still trying to do this movement with this arm. So and pushing. And you can still get a contraction of the rotator cuff muscles. So that's another good alternative if you have difficulty with that. You can do the same thing with internal rotation on a wall also. Same thing up here. You can do the same basic things if range of motion is difficult or painful for you. So those are the general basic rotator cuff muscles that are often provided. Like I said, that's a very close note version. There are tons of alternatives. But you guys do a couple really basic stretches for your rotator cuff. Obviously, we have the ones that I already showed you. We take the band for example, and I'm letting the band actually pull my arm that way to get a bit of a stretch in there. Right? So this is really trying to externally rotate me further than my arm naturally wants to go. So there's things like, that. There's the same one I'm showing you sitting, where you're like this. Only do these where you're doing, passive or even active stretching movements, if it's not painful and if you are cleared to do so, obviously. So those are two simple ones. Another one that people often see, that you see people doing, is where they reach behind the back and over the head. So they're like this. They're doing this and they're doing this motion here. And they're trying to get their fingers to touch. So on this side, I can just get mine to touch. For example, if I switch, I'm nowhere near touching. And that's because my right rotator cuff isn't as loose as my left rotator cuff. It has less range of motion. So a common stretch for that is if you take something like my band here that I use, I put it over my hand and I reach down, kind of like this, and I slowly, work on pulling each one together. So I can pull downwards to bring my top arm down, or I can pull upwards to bring my bottom hand up. And you slowly just work on bringing them together. So the way I need to work on it is this way. So if you see, I have a very difficult time even reaching the band on the side. So for me, this is what I need to work on. Where I work on, for me, I got to pull the band upwards to help work on bringing that right arm up further. And you just go tighter and tighter, and then you work on. You can hold it for 30 or so seconds if you want, or if you want, you can do you can do kind of waves where you go down and you pull it back up. Get movement going. Tons of different kind of modalities, but that's in general a great stretch to work on. And you'll see kids doing those kind of ones all the time, and it's a great kind of test to see which rotator cuff is more loose, if they're even, do you have appropriate range of motion. If you can go and you can make your fingers touch, that's fantastic, great job. If you can't, hey, you have something that you can work on. So that's all that I wanted to show you guys today for a really general basic overview of the rotator cuff, some rotator cuff exercises, and a couple stretches at the end. They are a very important muscle group. I highly recommend people, not necessarily, it should never be someone's main focus, hopefully, unless it's injured, but it's a great kind of secondary focus to always be, cognizant of your rotator cuff health when you're trying to be physically active. So I hope you enjoyed that video. If you have any questions, feel free to post them down below. My name is Adrien. I'm the exercise specialist at the Leduc Beaumont Devon Primary Care Network. Thank you so much, and have a great day.